Hello, everybody. My name is Logan with the San Luis Obispo Tribune. Today I'm sitting down with Matthew, a physician and diabetes specialist, Shifra, a local public health official in the Health Promotion Division, and Hogan, a public health official with the Planning, Evaluation, and Policy Division, representatives from the Stronger Than Sugar Foundation. The Stronger Than Sugar Foundation is a group of experts and community members who have come together to spread awareness of type 2 diabetes and encourage healthy lifestyle changes. A large part of living a healthy lifestyle and managing type 2 diabetes is the incorporation of a healthy diet. With the recent changes in administration and changes in funding for multiple government subsidized programs, one program that is being hit especially hard is Supplemental Nutrition Assistance Program, or SNAP for short. SNAP is a federally funded program that supports low income individuals and families in purchasing enough food for proper nutritional needs. As of November 1st of this year, the USDA and United States government will no longer issue these benefits to previous recipients. With this, it leaves me with some questions regarding how these cuts will affect the general population. With the recent government budget cuts and policy changes, how do you think people's access to affordable healthcare and healthy food has been affected?
Thank you, Logan. Yeah. Cuts to food assistant programs like SNAP and EBT really limit people's ability to afford and prepare healthy meals. When families don't have a lot to spend on food, they often turn to cheaper, highly processed foods that are higher in sugar, salt, and fat. And in short, reducing access to nutritious foods affects people's diets and even impacts the entire spectrum of their health and well-being.
Yeah, adding on to the topic of those being affected, could you see these policy changes making it more difficult for people living with diabetes to manage their condition or maintain good health?
Oh yeah, definitely. As Schieffer stated previously, many people who are affected by diabetes and are on SNAP benefits may have to turn to cheaper, less nutritious food options to ensure proper food intake day to day. Over time, these diets may make it harder for individuals to manage diet-related conditions like diabetes. This can lead to serious complications such as heart disease, nerve damage, or kidney issues, all of which are common concerns for those with diabetes. This can lead to more frequent and expensive doctor visits and a greater demand for medical care. Overall, patients with type 2 diabetes on SNAP may feel a recognizable impact in their overall health and condition management.
I see. In order to foster a more healthy country, what kinds of policy priorities is your department now focusing on to help support healthy living in the United States?
Currently, one of our major policy areas that our department is focusing to promote is healthier lifestyles in chronic disease prevention, which aligns with the National Healthy People 2030 initiative. This initiative sets key goals for improving overall health outcomes across the country, including ensuring that communities have access to clean drinking water, reducing smoking rates, emphasizing improving access to nutritious foods, as well as encouraging physical activity. And all of these efforts work together to create a healthier, more resilient community.
That's amazing. Do you guys think that there's anything the general public can do to help push against the negative effects of these new policies?
Oh, yes, absolutely. The public can get involved by signing petitions, reaching out to their local and state representatives, and encouraging them to support legislation that strengthens food assistance programs. Voting for policies and leaders who prioritize public health and nutrition access is one of the most powerful ways to make a difference. Organizations like the Food Research and Action Center, or FRAC, provide updates on current legislation, advocacy tools, and ways for individuals to take action to protect and expand SNAP benefits. Get out there and exercise your vote. It truly makes a difference.
Amazing. Thank you so much for answering all these questions in such detail and being so informative for our viewers here. I want to end this interview on a more positive note after talking about all these different changes and see what you guys know about the future of public health programs relating to SNAP benefits. With the recent cuts in funding for CalFresh and the plan for the elimination of the CalFresh Healthy Living Education Program, will local health departments implement any of their own new programs or implement anything in specific to combat the negative effects of this?
Yeah, local health departments will definitely do what we can to expand community-based programs, but replacing the funding and reach of the CalFresh Healthy Living Education Program will definitely be a real challenge. We're looking to strengthen partnerships with local schools, community centers, and nonprofits to continue offering nutrition education and support where possible. However, without the same level of state funding, it's difficult to really reach out to every household that benefited from these resources. We'll continue to focus on promoting healthy eating and active living in the type 2 diabetic community as well as the general public. Please use the information we have provided as well as your vote to ensure that SNAP benefits will not disappear forever. Stay informed and stay optimistic.
Thank you so much for that. Thank you guys again for talking to me today about the effects of SNAP benefits on the diabetic community here.